Hey everybody, my name is Tamara Núñez. I'm a medicine student in the Universidad Católica de Santiago de Guayaquil, and the topic I'm going to talk about is the osteochemonecrosis after mandible reconstruction. First and everything, we need to know the definition of osteonecrosis. The osteonecrosis is defined as an area of exposed bone that persists for more than 8 weeks. It is divided into osteochemonecrosis and osteoradionecrosis. The osteochemonecrosis will be caused by bisphosphonates treatment, and the osteoradionecrosis will be caused by radiotherapy. In these pictures, we can observe the exposed bone, of a patient with osteonecrosis. The ONJ, or the osteonecrosis of the jaw, can be defined according to 5 criteria. First, patients previously or currently treated with biphosphonates. Second, soft tissue lesion exposing the underlying bone. Third, persistence of exposed gray-yellowish bone for more than 8 weeks. Fourth, absence of antecedent of radiotherapy in the maxilla and mandible. Fifth, absence of metastatic zone in the region of osteochemonecrosis. Here we have a video that will make us understand even more what the osteonecrosis is about.
Osteonecrosis is a disease caused by reduced blood flow to bones in the joints. In people with healthy bones, new bone is always replacing old bone. In osteonecrosis, the lack of blood causes the bone to break down faster than the body can make enough new bone. The bone starts to die and may break down. You can have osteonecrosis in one or several bones. It is most common in the upper leg. Other common sites are your upper arm and your knees, shoulders and ankles. The disease can affect men and women of any age, but it usually strikes in your 30s, 40s or 50s. At first, you might not have any symptoms. As the disease gets worse, you will probably have joint pain that becomes more severe. You may not be able to bend or move the affected joint very well. No one is sure what causes the disease. Risk factors include long-term steroid treatment, alcohol abuse, joint injuries, having certain diseases, including arthritis and cancer. Doctors use imaging tests and other tests to diagnose osteonecrosis. Treatments include medicines, using crutches, limiting activities that put weight on the affected joints, electrical stimulation and surgery.
Well, after we know what osteonecrosis really is, we can continue with the presentation. In 2003, it was reported the use of biphosphonates as the main cause of the osteochemonecrosis of the jaw. But what are these biphosphonates? Well, biphosphonate-mediated inhibition of osteoclast function seems to decrease bone resorption and inhibit normal bone turnover remodeling. Bone resorption and remodeling play an essential role in maintaining normal bone homeostasis. As osteoclasis occurs, cytokines and growth factors are released into surrounding matrix essential for modulating new bone development. This picture shows us the way that biphosphonates act in the surface of the bone. The little yellow circles represent the biphosphonates. The way they will act is by inhibiting tumor cell adhesion to the bone, as we can see. In second place, they will inhibit osteoclast activity. And in third place, they will induce osteoclast apoptosis. The osteoclasts will be the one that will promote the destruction of the old bone cells so that the osteoblasts will build the new bone cells. To understand this topic, I present this case of a 56-year-old woman who underwent radical nephrectomy and lymph node resection for clear cell renal cell carcinoma in February 2012. She presented metastases of the body at the left mandible. In October 2012, she came for resection of the mandibular metastases and fibular free flap reconstruction. There was a complete resection followed by normal healing. 2 months later, a bone metastasis to the humerus and the pelvis were detected. Antiresorptive treatment was initiated in April 2013. Denosumab along with sunitinib, calcium and vitamin D. There wasn't glucocorticoids or bisphosphonates, not even radiotherapy at any time. In January 2014, she was noted to have visible bone in the area of the graft with inflammation of the surrounding tissues. It was thought to be a recurrence of the tumor, but biopsies were negative. There was an increase in the extent of bone exposure and necrosis without evidence of infection. CT showed increased bone density, periosteal bone apposition, and bone sequestration, all characteristic findings in osteonecrosis of the jaw. Here we can see a more specific case of osteonecrosis. Well, the case of this woman showed a treatment with Denosumab. Now, what is Denosumab? Denosumab is a mononuclear antibody. Mononuclear antibodies are made to target and destroy only certain cells in the body. This may help to protect healthy cells from damage. Prolia, as it is also called, is used to increase bone mass in women and men with a high risk of bone fracture. Denosumab is a RANKL inhibitor which works by preventing the development of osteoclasts, which are cells that break down bone. It was developed by the biotechnology company. This picture shows us the way that Denosumab acts. So, the Denosumab is represented by the white purple letter. It will bind to RANKL receptor, which is the purple circle, and it will neutralize its activity. So it will reduce osteoclast activity and the bone resorption. Here we have a video that explains how the XGEVA or the Denosumab or the Prolia actually works.
The bones are the most common site of metastasis in cancer. Xgeva is a treatment for bone metastasis from breast, prostate, lung, and other solid cancers. Xgeva is the trade name. Its generic name is Denosumab. Xgeva is made by Amgen. Xgeva is a treatment for bone metastasis. to prevent fractures, damage to the spinal cord, called spinal cord compression, severe bone pain, and high levels of calcium in the blood. Exgeva is not approved for use in patients with multiple myeloma, a type of blood cancer that can affect the bones. When cancer has metastasized to the bones, it causes weakening of the bones. Exgeva counteracts this process and strengthens the bones so they don't hurt, break, or cause high levels of calcium in the blood. Exgeva is an antibody developed in the lab that works on bone cells. It helps to keep bones stronger by blocking proteins that destroy bone tissue. Exgeva is given by a shot under the skin, in the upper arm, upper thigh, or abdomen once a month for as long as it is working or until it is not tolerated. Common side effects I see in my patients can be fatigue, weakness, and nausea. More serious side effects include osteonecrosis of the jaw, which is damage to the jawbone, shortness of breath, low calcium levels in the blood, allergic reaction, and rarely a fracture of the femur bone. One of the side effects that is serious is called osteonecrosis of the jaw. To try and prevent this side effect, a dental exam should be performed prior to beginning treatment with Exgeva. Another precaution to avoid side effects is to take adequate calcium and vitamin D. Women and men should consume calcium 1,000 to 1,200 milligrams per day, and vitamin D 800 to 1,000 units per day. Exgeva can cause fetal harm, so it is important not to be pregnant or become pregnant while taking it. Exgeva improves the quality of life for patients with bone metastases and helps keep their bones healthy.
Now we're going to analyze the pros and the cons of the Exgeva, the Denosumab, or the Prolia, as it is also called, right? So the pros, it's convenient because Prolia is administered in just 2 shots a year rather than a pill every day. Second is that the digestive system is avoided. And the third pro is that Prolia works where other osteoporosis medications fail in case that it is used for the osteoporosis treatment. So in the cons, we have low levels of calcium in the blood. That's why it is really important to administer calcium while the patient is having a treatment with Prolia. It will cause also jaw problems or osteonecrosis, pains in the muscles and joints, feeling short of breath, diarrhea, and excessive sweating. So the conclusion after this presentation is that the osteonecrosis is a condition where jaw becomes visible inside the mouth and it doesn't heal over it within 8 weeks. Even though this condition is linked to the use of bisphosphonates and radiotherapy, the case that was presented before of the 56-year-old woman showed that the Denosumab is also a possible cause of it. This means that the osteochemonecrosis is directly associated with pharmacotherapy.